Hey guys, in this video, I want to talk about osteoarthritis. Hey there, this is Wei, your exercise physiologist. Now, let's start simple. Let's break this word down so you kind of understand what this long thing means. So, osteoarthritis, if we were to break down, osteo means bone, arthritis means the joint, itis means inflammation. So, there's bone, joint, inflammation. Okay? Now, many people have this trouble, have this problem when it comes to osteoarthritis because whenever they have a pain, they go for some scans and they find that there's something on the bone, and then they will be diagnosed with osteoarthritis. Now, that may be happening, okay, but that may not be the cause of the problem. Let me explain. Think about this, okay? When you are asked or when you are told that somebody has an osteoarthritis, what's the first thing that comes to mind? Usually you would be told that it is because of degeneration, it is because of loading, and osteoarthritis is because of old age, right? To a certain extent, yes, I have to agree, but most of my contacts, I have to say, sorry, I don't take that as a explanation, right? Because if it is a degeneration, how come it's usually only happening on one side of the body? For example, your knee. How does the knee generation happening on the left knee and not on the right knee? Okay, so my question is always, if you have a degeneration, why is it not the entire body? Why only the knee? Okay, there are many reasons behind to why I ask this kind of question. All right, and the things that I do usually has to do with your muscle. All right, as you may have known. Now, this is the thing. If your biomechanics has been always not perfect and you have always been relying on one leg and the other leg becomes weaker, and when certain motions, certain movement require you to use that weaker side, okay, it is like making you work harder. Or in another sense, maybe the muscle is not strong enough, all right? What's happening is that the bones are actually pounding on each other now, right? So you think about it. If I have a surface and I have a hammer, and if I keep pounding on it every day, okay, every time when I move, it keeps happening, all right? What's going to happen to the table? You start to see that there's a deformity, okay? You see, it depends on the severity. You can actually see that the table, maybe some parts of the wood is chipping off, okay? So this is now happening, okay? Pounding every time, every movement, and that's happening to your knee as well, okay? Now, if I have something that restricts this pounding, say for example, if I tie a string or a band to this hammer now, okay? And every time when I try to pound, as soon as I get closer, it's almost like a touching and off, almost no pounding at all, okay? Reason why I'm giving this example is, if you have a weaker knee on that side, it's going to be that pounding. If your muscles are strong enough to resist that kind of pounding, it's just going to be touching and go. This osteoarthritis thing will not even happen. Your cartilage will still be there, okay? So always ask yourself this question, okay? Why is it on one side and why is it not on both sides? If you are being diagnosed and somebody tells you it's a degeneration, okay? So that's always the very common thing that I will ask, and they can't seem to answer, all right? And then I'll explain a bit more. Sometimes I even go and test certain movements and to try and get them to understand. All right, one side of the knee and the other side of the knee, this side of the muscle, same side, different side, same muscle. All right, and usually you could tell that there's something wrong with the muscle. Okay, that muscle represents the band that I was talking about earlier on when I talk about hammering of the knee. Okay, so if that's happening to you, and you are asked to go for surgery, okay, you can have a knee replacement. You now have a new cable, okay, you have a new hammer, give it to you, no problem, but you don't have the band, okay, it's still gonna knock on your new cable. Sooner or later, it's still gonna give you the same problem. Okay, this is one of the most common thing, although it's a diagnosis, but it's not the root of the problem. Okay, I hope you take something away from this. Always question, always ask why, because don't take somebody's diagnosis and just say, okay, I am with this condition. Always ask, okay, find out more, okay, be more resourceful. Okay, so that's all I have for you, right? So that's for osteoarthritis. I hope you enjoyed this video. If you like this video, give me a thumbs up, subscribe to my video, and if you have any question, please post it on the comment section below. I will see you soon. Please take care. Bye bye.